Okay, in this brief video, we're going to be looking at the muscles of the forearm. We'll look at it from the anterior, and then we'll look at it from the posterior as well. So to review, what we have on the anterior arm was the biceps brachii, which can flex the elbow, right? Elbow flexion, and it can do shoulder flexion. Whereas the triceps can extend the shoulder and also extend the elbow, or elbow extension. Now, when we move distally and we're looking at the forearm muscles, what's unique here is that many of these forearm muscles are going to originate on the distal end of the humerus. So they're going to cross the elbow, especially here. These muscles, these superficial muscles that we see on the anterior forearm, many of them originate on the medial epicondyle of the humerus. They originate on the medial epicondyle of the humerus right here. It's a common attachment. Sometimes they call it the common flexor tendon attachment. Now, there are 1, 2, 3, 4 muscles that are important to know that have an origin on that medial epicondyle. Okay, and we're going to look at them from lateral to medial. So the most lateral is the Pronator Teres. Then we move medial to it, Flexor Carpi radialis. Anything on the anterior forearm is going to flex the wrist. So when we talk about wrist flexion, the wrist is carpi. So it's flexor. If we look at it, it's going to go right here. Looks like it's crossing the wrist, flexor carpi, and it's on the thumb side, which is the radial side, flexor carpi radialis. On the opposite side, I'm going to skip the Palmaris Longus for a second, but all the way on the medial side is a flexor carpi ulnaris, and that's on the pinky side. So again, there's a flexor carpi radialis and a flexor carpi ulnaris. Between the flexor carpi radialis and the flexor carpi ulnaris is this muscle that has this long tendon that goes right down the center of the palm, and that's called Palmaris Longus. Now, the Palmaris Longus, let me zoom in on it. The Palmaris Longus is the only one of those tendons that crosses superficial to this ligament that runs across. This ligament has a few names. One of them, since it runs transversely, and it runs transversely near the carpal bones, they call it the transverse carpal ligament. Again, it's called the transverse carpal ligament. That's this soft tissue that looks like the part of a watch band that's going left to right. Another name of it is called the volar ligament, V-O-L-A-R, the volar ligament, V-O-L-A-R, the volar ligament. And the third name is called the Flexor Retinaculum, the Flexor Retinaculum, Flexor Retinaculum. Now, what the Flexor Retinaculum does, or the volar ligament, or the transverse carpal ligament, what the Flexor Retinaculum does is it's a ligament that goes from the carpal bones on this side to the carpal bones on this side. And what's deep to it are all these flexors, and all of these finger flexor tendons that you see here are deep to the flexor retinaculum. And what's deep to the retinaculum is also this yellow nerve that goes to the thumb, the second digit, the third digit, and even half of that ring finger. This yellow nerve is called the median nerve. Median nerve. So if you've ever heard of carpal tunnel syndrome, carpal tunnel syndrome, the roof of that carpal tunnel is this. It's the flexor retinaculum. That's the roof. Whereas the floor is the carpal bones. So you have a roof, the flexor retinaculum. You have the floor, which is the carpal bones. And then you have this tunnel. And what travels through the tunnel are all the finger flexors and the median nerve. And that's why people can get carpal tunnel syndrome, which is compression of the median nerve, if these tendons hypertrophy, meaning they use their wrist and their fingers repetitiously over and over, and they thicken. If these muscles or tendons thicken, then there's less room in that tunnel for the median nerve to travel. And the thickening of those tendons can pinch the median nerve, and then you get numbness or shooting pain to the first, second, third, and half of that ring finger. Okay, so let's go back. And now we see Palmaris Longus is superficial to the flexor retinaculum. Doesn't run deep to it, it's on top of it. Okay, so again, we have the Pronator Teres, which can pronate the forearm. And anything that the forearm does, remember the hand just comes along for the ride. So if the forearm pronates, the hand pronates. If the forearm supinates, the hand comes along for the ride, it supinates too. So Flexor Carpi radialis, the Palmaris Longus, and the Flexor Carpi Ulnaris, all of these are going to flex the wrist, not only flex the wrist, but if the muscle is more on the radial side, it'll radially deviate. And if a muscle is more on the ulnar side, it can ulnar deviate. So we have flexion of the wrist, but the flexor carpi radialis, when it contracts, it can pull this muscle more to the radial side. It can pull the wrist to the radial side. And then the flexor carpi ulnaris, not only can it flex the wrist, but it pulls the hand to the ulnar side. Kind of like a karate chop, if you think of that. So that's called ulnar deviation or radial deviation. Ulnar deviation and radial deviation. The other name for radial deviation is abduction of the wrist. And the other name for ulnar deviation is called adduction of the wrist. Adduction of the wrist and abduction of the wrist. Okay, so it's can have some multiple actions here. All three of them can flex the wrist, but if we're isolating just the flexor carpi radialis, it can abduct the wrist, whereas flexor carpi ulnaris can adduct the wrist. Okay. There's another muscle that it's showing up here called the Brachioradialis. It's a really interesting muscle because it's the only muscle in the body that originates at the distal end of one bone and inserts on the distal end of another bone. So the brachioradialis originates from the distal end of the humerus and it inserts at the distal end of the radius. No other muscle does that in the human body. So it's kind of a unique feature of the brachioradialis. No other muscle begins at the distal end of one bone and goes to the distal end of the other. So brachioradialis originates at the distal end of the humerus from the lateral epicondyle of the humerus, and it inserts on the radial styloid. And it's called the brachioradialis. It is an elbow flexor, but we call it the politician muscle. It's like a handshaking muscle. So it flexes the elbow, but not in a supinated position, not in a pronated position, more in a neutral position. So when you flex your elbow in a neutral position, it would be like shaking someone's hand. That's what the brachioradialis does. Okay. Since we're on this picture here, these muscles here of the near the thumb, these are called thenar pad muscles. And these of the pinky side are called the hypothenar pad muscles. So you have the thenar pad and you have a hypothenar pad. Okay, let's take a look. Since we're looking at the anterior, let's go to the posterior next.